Hi there, everybody. My name is Ellie. I will be doing the run through of your first dissection that you guys did before spring break, all the structures from your lab guide. If you have any technology questions, just raise your hand or get one of our attention and we will try to get you all set. So we will start with the cartilage and the bones of your neck. We will start with the thyroid cartilage. On the thyroid cartilage, you're going to have a prominence called your laryngeal prominence, otherwise known as the Adam's apple, which will be just right here. Inferior to your thyroid cartilage, you will have your cricoid cartilage, and then superior to your thyroid cartilage, you will have your hyoid bone. This is a bone that not a lot of people are aware of. There are some bony landmarks on your osteology checklist that you should be aware of and able to write out if tagged on the exam. So your thyroid cartilage is large on the anterior side and is actually pretty small and does not cover the posterior side. So let me get rid of the cervical vertebrae to give you a better idea here. So, like I said, thyroid cartilage is large anterior, and then there is no posterior aspect. So your cricoid cartilage here is actually going to be bigger on the posterior aspect and smaller on the anterior aspect. Kind of finishes that C. Go back out to the front. You are going to have a right and a left lobe of the thyroid gland, along with the isthmus connecting those two lobes. And then these are the basis for a lot of muscle attachments that you guys are required to know. So let me get that pulled up here. So some of the larger muscles that you will be required to know is your platysma muscle. So a super thin and pretty large muscle on the anterior aspect, and it kind of covers all your important structures of your neck. So if I remove that on both sides, you will now have your sternocleidomastoid muscle. And this is a pretty thick muscle that helps with turning the head, a lot of movements of the neck and the head. And the other muscle that you are responsible for is trapezius muscle. It's going to be on the superior aspect of your back. And you should be familiar with this muscle from the back unit. So let me get rid of sternocleidomastoid. The other muscles that you are responsible for are divided into two subcategories. So your first one being your infrahyoid muscles, which is anything below the hyoid bone. And then the other group would be your suprahyoid, which is anything above the hyoid bone. So we're going to start with infrahyoid. First muscle will be your sternohyoid muscle, going from your sternum to your hyoid bone. And this is a pattern with all these muscles, is they are named for where they come from to where they are going. So here, sternum to hyoid, sternohyoid. The other muscle that you are responsible for on the inferior aspect is going to be your omohyoid muscle. So there are two bellies of your omohyoid muscle. Will be a superior belly, pointing to right now, and then there will be an inferior belly on the inferior aspect of the muscle. If I turn this around and remove omohyoid and sternohyoid, it gives you access to one more muscle. This is your thyrohyoid muscle. So going from your thyroid cartilage to your hyoid bone. Those are the three muscles that you're responsible for your infrahyoids. Now let's go to your suprahyoids. So we will start with the digastric muscle. So here will be your anterior belly of the digastric muscle, and this will be your posterior belly of your digastric muscle, going to your mastoid process. This is held in place and allowed to do that turn by your intermediate tendon. And then on split around this intermediate tendon is going to be your stylohyoid muscle. So going from your styloid process to your hyoid bone. And the last muscle you're responsible for here is your mylohyoid muscle, which is this guy right here. This goes from your hyoid bone to the mental spines of your mandible. So those are the muscles that you are responsible for. Let's now do some veins. Let me turn this for you. All right, so on the more lateral or superficial aspect of your neck will be your external jugular vein, and then medial and deeper will be your internal jugular vein. Going back up to the face, you're going to have your facial artery, and then following that, we'll have your facial vein. So we're just looking at veins right now. So here's your facial vein, wraps around the mandible, and will dump into your retromandibular vein. Retromandibular is going to run inferior to the ear and through that parotid gland. So here's retromandibular. Retromandibular vein will then dump into your internal jugular vein. And let me switch cadavers here. So here's a better idea. We're going to have facial dumping into your retromandibular, which dumps into internal jugular, and then also dumping into internal jugular will be your anterior jugular vein, which drains the anterior aspect of your neck and a lot of the muscles and thyroid gland and areas we just went over. So again, anterior jugular, internal jugular, external jugular. External and internal are going to dump into your subclavian vein. Let me make this more visible. So subclavian vein, and then your subclavian vein and internal jugular will then create your right and your left brachiocephalic vein. So just a few more structures. We are going to go into the brain. You're responsible for 2 different cranial nerves. Just get this all settled. Okay, I'm going to take away the cerebellum so we can get a better look at the brain stem here. So here's your medulla, and then your pons will be in the middle, and then up here, so pons, and then you're going to have your midbrain more superior. So coming off of your medulla, here and here, you are going to have spinal accessory or cranial nerve 11. So spinal accessory here, you can see lots of branches coming off of that medulla, and then spinal accessory cranial nerve 11 will then descend and do a lot in the body. The other cranial nerve that you're responsible for is going to be your hypoglossal. Just give me a second to find it. Let me get rid of cranial nerve 9. So here is your hypoglossal cranial nerve 9, and this comes off of the pons, or also the medulla, excuse me. Hypoglossal comes off of the medulla, and hypoglossal is responsible for the innervation to the muscles of the tongue. So I believe that is all of the structures that you are responsible for. If you have any questions, let us know. Otherwise, I hope you enjoyed this run through. Thank you.